Microbiology Unknown Presentation by Jasmine Hershey. After receiving my unknown bacteria, I knew my first step in discovery would be to observe its morphology. I inoculated a nutrient agar slant and a nutrient agar plate. After 24 hours, there was thick, abundant growth that appeared cloudy or whitish, was irregular in form, and had a somewhat buttery consistency. I was immediately able to rule out Pseudomonas and Serratia from my previous experience with their morphology, specifically their pigmentation, from the first few labs. I would next need to determine if my unknown was gram-positive or gram-negative. I performed a simple gram stain procedure to help me better understand the type of bacteria I was dealing with. The gram stain procedure proved to be very confusing, however. It seemed as though there were both pink and purple organisms on the slide. Had I already contaminated my specimen, or did I just have poor technique? Or was there something else happening altogether that further testing could explain? The only information that was useful from this procedure was the clear, visible rods shown, but I knew I would need to perform more tests. To help me better understand the results of my gram stain, I decided to perform an acid-fast test. I knew that some gram-positive rods can have thick, waxy layers that can prove difficult to retain dye. I had hoped that the acid-fast procedure would prove important and explain the inconclusive results of my gram stain. Unfortunately, my acid-fast came back negative and did not appear helpful. An interesting characteristic I did observe was the palisade arrangement and the cocobacillus shape of the bacteria that I had seen in lab previously. This further fed my suspicion of a gram-positive rod. I decided to use selective media plates to isolate my unknown. I inoculated a phenyl ethyl alcohol and crystal violet plate to once and for all distinguish between gram-negative and gram-positive. After 24 hours, success. The crystal violet plate showed no growth and the PEA plate had clear, abundant growth. I knew that the crystal violet plate was inhibitory for gram-positive organisms and the PEA plate was inhibitory for gram-negative organisms. This meant that I was dealing with a gram-positive rod, which left me only 3 choices: Corynebacterium xerosis, Bacillus cereus, or my original suspicion, Mycobacterium smegmatis. I knew the acid-fast procedure would be the definitive test, but I wanted to be sure and chose to perform other tests to distinguish between these 3 bacteria. During the next several days, I inoculated my unknown alongside most of my other tests performed in lab. My gelatin returned a negative result, which ruled out Bacillus cereus, but my litmus milk appeared to have peptidization, which put it right back on the table. The catalase tests were positive, and the hydrogen sulfide production proved negative, which really didn't help much since all of the gram-positive rods yield these results. The lactose test proved negative for acid production, while the dextrose test proved positive, which still didn't help me much with any new information. With every intent on performing another acid fast, I came to class and was pleasantly surprised. My unknown had tested positive for urease. I could now definitively rule out Corynebacteria and Bacillus cereus, which left me with only one choice: Mycobacterium smegmatis. After referring to my lab manual and our previous encounter with mycobacteriums, I was reminded that this particular bacteria has a tendency to clump together and resist dye. So to be 100% sure, I would need to perform another acid fast. I was concerned that my bacteria in my original broth culture were running out of room and nutrients, and I didn't want to take any chances with dead bacteria. I decided to use a sample from a nutrient agar slant that I had been storing at 25 degrees Celsius. I wanted to obtain the smallest amount of sample as possible to avoid clumping, so using aseptic technique and the needle, I obtained a pinpoint amount of bacteria to mix with water on my slide. Following the directions to a T, I performed the acid-fast procedure again, only this time, success. I had a feeling that my results would not be impressive due to the amount of time that had passed and the possibility of dead bacteria. In the picture on the left are my results. Although there is not a dramatic contrast, it is there. The rods retain the carbonyl fusion due to their waxy layers and were resistant to the decolorization step, proving to be acid-fast. The picture on the right is an image found online, used for comparison purposes only to help better understand the results of the acid-fast procedure. After multiple laboratory testing, I can say with confidence that my unknown bacteria is Mycobacterium smegmatis. Mycobacterium smegmatis is a gram-positive, acid-fast rod containing a thick, waxy wall. It is a biosafety level 1 organism that is found in normal genital secretions from the urinary tract. This bacteria is a model organism in research due to its fast generation time, and it is not considered pathogenic to humans. However, it is significant to note that Mycobacterium tuberculosis and Mycobacterium leprae are pathogenic to humans, so diagnostic testing using the acid-fast procedure is important. This concludes my unknown presentation. Thanks for watching.